After giving birth, something feels different. You leak when you cough, when you laugh, when you run, your back hurts more than it did before, and your core, it feels like it's simply gone. If this sounds familiar, you are watching the right video. Because today I'll show you exactly what happened to your pelvic floor during birth and the 3 steps to start recovering it. Hi, my name is Elisa. I'm a physiotherapist and osteopath specializing in pelvic floor and rehabilitation. And this is something I see every single day in my practice. So let's start with what's actually happening in your body. After birth, most women experience at least one of these symptoms: urine leakage when you sneeze, cough, or run, a feeling of heaviness or pressure downward, or persistent lower back pain that just won't go away, and a core that feels disconnected, no sense of stability, no control. Now, most women are told that this is normal, and yes, it is common, and it's quite normal for a few weeks after giving birth, but common doesn't mean that you have to live with it. The reason these symptoms appear is this one. Your pelvic floor has been supporting the full weight of your baby for 9 months. And during birth, whenever vaginal or C-section, it goes through enormous stress. It gets stretched, compressed, and in some cases, partially detached from this natural resting position. So when birth is over, the pelvic floor does not simply go back to how it was. It needs time, it needs the right input. Here's what nobody tells you. The standard postpartum check, the one at 6 weeks, does not evaluate the pelvic floor. It checks the uterus, it checks the scars, if you had a C-section, and that's it. No assessment of the pelvic floor strengthening or coordination. No evaluation of diastasis recti, separation of the abdominal muscle, as you can see here. No check of your breathing pattern, which changes completely during pregnancy and doesn't always come back on its own. So you leave the appointment with the green light to resume your life, but nobody has looked at the actual system. And this is a mistake I see most often. Look at this. This is a pelvis. Here at bottom, the pelvic floor. Behind, the lower back muscles. On the side, the hip muscles. Here. And on the top, here, there is the diaphragm. All the structures does not work in isolation. They are one system that every time you breathe, all 4 responds together coordinated. Every time you move, lift, cough, they have to coordinate. So when your pelvic floor is disrupted after birth, nothing in the system works the way it should. And this is the part that surprised most women. The problem is not always the weakness. Sometimes, not always, but sometimes after birth, the pelvic floor is actually too tight because of the trauma. This is called hypertonia. The muscles are contracted, guarded, and not releasing properly, like a cramp. And you start doing like Kegel exercise on a hypertonic pelvic floor, and you make things worse, not better. And it's not rare. So before you're doing anything, I need you to understand what your pelvic floor actually needs. So what do? I'm going to give you 3 steps in order to understand your pelvic floor. Do not skip ahead. Let's start. Step 1, diaphragmatic breathing. Start with this first 1 or 2 weeks. This is the first thing to recover before any exercise at all. So lie on your back, knees bent, place 1 hand on your chest and 1 on your belly. Inhale through the nose and let the belly rise and the chest stay still. So you expand only the belly. Exhale through the mouth and the belly gently falls. This is not a relaxation breathing, this is functional breathing. It's different from yoga or meditation. Every time you exhale, your pelvic floor gently rises and responds. You're already retraining the system without doing Kegels or exercise, hard exercise. Do this for 5 minutes, twice a day, in the first 1 or 2 weeks. Step 2, pelvic floor reconnection. Week 2 to 4 is when you reconnect. Now, before I explain this step, I want to say something important. This is not just standard Kegel. Standard Kegel is just a contraction, just a squeeze. What I want you to do first is the opposite, is a conscious release. Breathe in, and as you inhale, consciously let the pelvic floor go. Feel it drop, expand, open. Then, as you exhale, gently lift. Lift it slow, 3 seconds up, 6 seconds down. So, contract, 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 and relax, 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 relax. So 3 seconds up, 6 seconds down. The release is twice as long as the contraction. This is the part most women have never been taught, and it changes everything sometimes. If at any point it produces pain, pressure, or you feel nothing at all, that is a signal. Do not ignore the signal. That's when you need a direct evaluation. You can start with my free guide self-check, and eventually, if you want a 15-minute talk with me, it's free of charge. It takes 15 minutes and we'll tell you exactly what your pelvic floor needs right now. So let's go to step 3, core integration. So when you have reconnected your pelvic floor with your mind and your breathing, and you have reconnected your pelvic floor, then we add the core. And it means a progressive return to activity, not the gym, not running, not sit up, not at the moment. We start with controlled movement where the breath and the pelvic floor work together, like bridging, dead bugs, modified squat, and all with one rule. If you feel pressure downward or leaking or pain, stop. Regress, go back to step 2. Your body will tell you when it's ready. And please do not compare your recovery timeline to anyone else. It's always different. 6 weeks is not a medical clearance to run. It's the minimum starting point. Real recovery takes 3 to 6 months, and that's completely normal, especially for women who breastfeed. So let's recap. Step 1, diaphragmatic breathing. Step 2, pelvic floor reconnection. You can add more seconds if you want, like 3 and 6. You can go to 5 and 10. You can add more seconds to your program. Step 3, progress core integration. So from month 2, these 3 steps in order. A recovery after birth is possible. It does not require months of pain or accepting things that as they are. It requires the right information and the right starting point. If you all want to understand exactly where your pelvic floor is right now, download my free guided self-check. I'll put the link in the info box. So tell me in the comments how many weeks postpartum are you that you are watching this video. If you are still in pregnancy, write everything in the comments. I read every single comment and I respond to everyone. If this video helped you, please like and subscribe to the channel and see you next week.